I really recommend that everybody find a partner and team up. And when you practice, practice with a partner as much as you can. I mean, if you guys have to bunk up for the couple of weeks that we're doing this, whatever it takes. But come to the open labs. Come to anything you can, but don't just do it by yourself at home. Every semester we see people that practice and practice and practice at home and just don't come in here and demonstrate well. You're my partner for this. Okay. So if I miss something, because I'm going down my fancy little list, because this is what you guys are going to be doing today. Okay, I'm verifying my order, and I'm doing all this stuff. For our skill, we have our order. There's 2 of these. We'll have 1 on each end. I have my order. I have my labs. I can look on there, and I see that the labs was within 72 hours. I can see that he is A negative. His hemoglobin's 8.2. And that's pretty much all I need to do to verify that this person does in fact need to have his blood. This other folder has my order and my consent. I am going to, at this time, go to my patient's room and I'm going to introduce myself. Hi, Mr. Davis, I'm Tanya, and I'm going to be your student nurse for the day. And I understand that you're going to be receiving some blood today. Have you had blood before? No, I haven't. Okay, well, let me explain to you. With your consent, there are some reactions that could happen, and if that were to occur, then we'll talk about it then. Is it okay that we give you blood today? And he's going to say, sure. And so then we're going to have, and this is what you need to verbalize, I'm going to sign here, he's going to sign here. And then we're done with our consent. Thank you, I'm word searching already. I had a stroke a few minutes ago. Okay, we've identified, we have looked at his band. Our band has date of birth and name. We've verified our order. We've obtained our consent. And then we're going to get our baseline vitals. For this skill, we're going to give you the vitals. So his is 120/82, heart rate of 77, temperature of 98.6, and respirations of 18. Oxygen level of 97%. So I have all of my signs. I'm going to go get my tubing, which is right here in my fancy bag.
And did you check the IV
I
size?
didn't. Good for you. That's why you're my person. See? I told you that would work. Okay, so I have my alcohol. Do I need gloves or no gloves? Why do I need gloves? Okay. Any risk of having contact with, and I did hand hygiene and now I'm putting my gloves on. I'm scrubbing my hub for how long?
30 seconds.
Okay, so I've scrubbed for 30 seconds. I've aspirated. Did I get blood return? Yes, I did. So I am flushing 2 to 3, and it's flushing well. I don't see redness. I don't see any kind of bubble. There's no pain. He says that we are doing great. So now I'm in the room with him. I'm going to go ahead and do my, and leaving my gloves on is fine, but I don't do gloves very well. I'm old school. So I'll go ahead and take mine off because it really won't matter. Take it out of the bag. Clamp. 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 Okay. I'm gonna get my normal saline. At the hospital, guys, we're gonna get the little bitty bags, but because so many of you guys are practicing, I got out the big guy. I'm gonna hang it. Okay. For practice, I typically have the trash can down here, but there wasn't much room. So anyway, I have that. I have this clamped. I'm going to undo this one. I'm going to undo this one. All the way to the end. I'm going to carefully recap it. And then This one right here, if you don't have a trash can close, can make a mess. So just be aware. And where is this coming? Where's this going to go? This is the one that's going to the blood. I need to take this cap off because it makes enough of a suction where we don't have it. I'm going to fill up this just so it has further to go, less space with air. And then I'm going to send my fluid to the end. I'm going to put my cap back on. Okay. So do I have anything else that I need to do before I go get my blood? No? Okay.
You have a copy of the doctor's order.
I have my doctor's order. I have my labs. I have my consent. I have everything with me. I'm going to go down to the blood bank. And I'm going to come over here. And for the skill, I'm going to have to go through and find things that will work. Will O positive work?
What's your patient?
What is she again?
A negative.
A negative.
Okay. So I have a B negative. I have an A negative. Will that work?
Yes.
Yes.
Well, I'm going to keep looking just in case. I have an O negative.
Yes.
Yes.
O negative will work. So if I have a choice between an A and an O, what am I going to pick?
Oh, because it's more common. Hey.
We're playing that guessing game.
We're going to do the A. And why would we want the A?
You want it to be as similar as possible.
It's as similar as possible. And who else can get this?
Everybody.
Everybody. So we don't want to waste it on somebody that we know. So I'm coming back with my fancy.
I was thinking that. I see.
We want to be thrifty with our resources, guys. And when somebody comes in that we don't know their blood type and we have a huge trauma, we need to have that O negative ready. So is it wrong? No. Is it failure of a skill step? No. But we want to have our A negative. So before I left, I told Nurse Betty that I'm going to be coming back with some blood so that she's ready and she's not stuck in a patient's room. Because then I'm going to come back with my blood and we're going to go back into the room and I'm going to say, I'm assessing for leaks, clots, and bubbles. And she's going to say, Nurse Betty's going to say the same thing. I'm assessing for leaks, clots, or bubbles. I have patient F007-12367. F007-12367. So it matches the right patient. I have A negative in the computer that's sitting right by him. I'm going to look and say that it's A negative. So we've both agreed. Unit number, it's on the back here, 0065457. That's also going to be in the computer. If he had a blood band, we might have a number. But for this intents and purposes, computer says the same thing. Unit number 0065457. Patient's blood band or wristband with the blood bank form. We don't have that, but it is part of your skills checkoff. So when you're practicing, just say that. And then the expiration is today. Nurse Betty says the expiration is today. So we have verified our blood. Now, we never spike these blood bags because they are so difficult to come by and they're so super expensive that we're going to then come to our fancy blood, which I recognize is huge, but there's a lot of you guys doing blood, so we wanted to make sure that we didn't run out each day. We can make more blood. So we have our blood bag. Let me verify that all of my clamps are clamped. Okay, I'm going to put on my gloves. Hang it. I'm going to find my little pigtail. It's never okay to let this dangle on the floor, dangle in the trash can. It needs to be within your possession at all times. I am, ooh, that didn't work well. Spiking my blood. I'm opening this side. And then I'm going to let it go all the way to the end. Okay, for our intents and purposes for practice, as long as you verbalize that, I don't necessarily need all of you guys to do it all the way to the end, because then we can say that we can practice more times. But verbalize that it's all the way to the end. And then we're recapping. I don't know what I did with my cap. Recap. And we are going to initiate the transfusion. If you're good, oh, here it is. If you're good enough to not, to leave it open and not compromise it, I'm just not. I'm afraid I'll touch it on something. So, I've already verified a patency. You will see people in the hospital verify a second time, but that's not part of the skill. So if it's up to you if you want to do it. I'm scrubbing for how long?
30
Seconds.
seconds.
Okay. I am attaching.
Did she put floss through
I am initiating my blood within 30 minutes of leaving the blood bank. I am going to set the pump and not worried about you guys putting all this together. This is just here because it looks more real. But I am setting the pump for 2 minutes, 2 mLs per minute, or 120 per hour. And I am going to stay with the patient for the first 15 minutes. I'm going to check vital signs at 5, 15, 30, 1 hour, and at the end of the administration. And I'm going to document in the patient's records. And that is the end. Questions?